Good morning and welcome to the RCPCH webinar on returning to paediatric training, essentials to ensure a successful return to work following a break from clinical practice. Today we have Dr. Trisha Radia, who is a consultant paediatrician at Croydon University Hospital and lead for the London School of Paediatrics Paediatric Return to Acute Clinical Practice course. And we also have Dr. Sarita Dipani, who is a Paediatric Oncology Grid ST8 trainee and CR UK Clinical Trials Fellow at Great Ormond Street Hospital, University of Birmingham, and co-organiser of the London School of Paediatrics Paediatric Return to Acute Clinical Practice course. So I'm now going to hand over to Sarita to start the presentation.
Thank you so much, Sarah. So we're both really excited to do this webinar because this is really a passion project for both of us, to try and ensure that trainees who are coming back to paediatric training after a break are adequately supported, because we know that this can be a really stressful time. It can create a lot of anxiety and loss of confidence. So I'm just going to go to the next slide. So just to go through the outline of the presentation, we're going to talk about why is support needed for those returning to work, and we've got some experience from that, having run a return to practice course for the last 5 years. And then we're going to talk a bit from that about the training experience and what their challenges have been. We want to give you some top tips about preparing for your return. And that will include talking about kit days, because we know that this is a useful resource but often underutilised. And then Trisha is going to do the second half of the talk, and she's going to focus on the Paediatric Return to Acute Clinical Practice course that we've been running here at the London School of Paediatrics over the last 5 years, and it's been a really successful course and developed enormously over that time. And she'll talk through that and what the lessons learned the lessons that we've learned. And then we'll just signpost you to some useful resources. And Trisha's also going to talk about something that we really feel is really important, which is about building resilience and talking about some self-care strategies just at the end. And then we have plenty of time for questions, we hope, so that you can let us know what your specific concerns are, and we'll try and help you out with those. So why is support required for clinicians returning to work? So it's long been recognised that time out of clinical practice can lead to attrition of skills and significantly a loss of confidence about people's competence. So really often the skill sets are there, but people just feel that they're rusty and that they're not going to be able to perform in the way they were before they had the break. And the Academy of Medical Royal Colleges actually has got some guidance that they published quite a few years ago, and then they've done an update in 2017. And in that, they've recognised an absence as short as 3 months can actually affect performance, but that the length of time away is a predictor of skills decline, i.e. the longer that you're away from work, then clearly your skills level and competence is going to be affected more. And it then stresses and highlights the importance of having good procedures for doctors returning to practice. But we know that this provision is really patchy across the country, and can be quite individual from trust to trust and from deanery to deanery. But really the guiding principle is to maintain patient safety. So we want to make sure that clinicians, when they come back, feel supported, feel competent, and therefore able to look after the patients to the best of their ability. And this is why this is such an important area. And I think there's been increasing recognition, particularly from Health Education England, that did a big consultation last year to show that this needs to be provided in a much more comprehensive way. And I think it goes without saying that this has become really topical in the last few months with the Hadiza Balgalba case. So Hadiza was, as you're all probably aware, a clinician, a paediatrician who had been off on maternity leave, and there was this instance where the boy who was under her care sadly died. And actually when the case was looked at, it was clear that there were a number of failings, and one of those was really about the preparation and the support she'd had about returning to work. So we feel that this really highlights what an important issue this is. And we, from our experience of running the course recently, have heard from so many trainees about their feelings of anxiety about coming back to the workplace and being put in situations that they don't feel prepared for. And we know that in paediatrics, taking time out is a particular issue. We know that many trainees are taking time out of training. In London, that's about 15 to 20% over the course of training. We also know it's a female dominant specialty, so that a large number of these breaks from practice are going to be for maternity leave. But we also know that people find it really difficult when they come back, and that attrition rates in paediatric training are high, particularly at middle grade level, and particularly when trainees are coming back after having had children, for example, because they find coping with the stresses of paediatric training together with their home life really quite difficult. And we know that that is one of the reasons that people consider leaving paediatrics and maybe changing specialty or leaving medicine altogether. So some of the reasons that trainees have for time out, and there's a myriad of reasons, but we know that maternity and parental leave are one of the most common. But clearly we have lots of trainees who take time out for research, and that can be a long period, particularly if combined with maternity leave. So we have trainees who might have taken 5-6 years out of clinical practice in order to do their PhD, have some time for maternity leave, etc. at the same time. And then there are a large number of people who take up fellowships like Darcy fellowships or education fellowships or work abroad. And then we know that people take leave to look after their parents, for example, for carers leave. They may have ill health themselves, and this is a particular issue when coming back, to make sure that you are supported by occupational health, to make sure that the adequate resources are in place to support you, and that you might have to have a staged return. And then there are some other reasons for career breaks as well. So this is a really diverse group of trainees, and that's why we have to really make sure that we can provide individual and appropriate support for them. So this is really a summary of some of the themes that we found when we've been surveying the participants on our course about what are the challenges they face returning to clinical practice. And broadly, they're in these 5 areas. So loss of confidence. So these are all direct quotes that we've had from trainees. So I don't feel confident about managing ill children in resus. And we know that confidence is particularly about acute situations, ill children, resus. So the other quote is, nights and on calls when I'm the most senior paediatrician but feel out of practice. And then we know that the next big issue is about knowledge gaps. And it's obvious that if you're going to have some time out, you're not on the wards, you're not in clinic, that you're not doing that day-to-day work, that you are going to forget things, or that things aren't going to come back to you as quickly as they would if you were still in work. So some of the quotes about that are, trying to think where they are. So often it's about them not knowing about guidelines, not knowing about the recent updates. Leadership responsibilities, so this idea about being the senior paediatrician, about leading other members of the team, but also that some people are doing a transition not back to work, but not only back to work, but also to a different level of training. So returning to a level ST4 that I've never worked before. We know that that makes people feel particularly anxious. And then this worry about the perception that others will have. So I'm worried about the perception others will have of me knowing I've had a break. So there's a real combination of people wanting to be supported, but equally worried that if they draw attention to the fact that they've been away, that somehow they will be regarded as less competent as their colleagues. Work-life balance is clearly a big thing, and that's not just for people who've had children, but clearly people who've been on maternity leave, suddenly having a child and having to balance all those responsibilities is huge. But then there's also the pressures of completing all the training requirements, educational needs. So we've got this quote here about achieving balance between clinical work, educational needs and home life. So that's a really big one, and I think that really doesn't go away whether you've had time out of training or not. So that's something that applies to anybody working within the NHS. And then sort of combined with the knowledge gaps is this idea of attrition of practical skills. So people feeling out of practice with regards to procedures, particularly if they're going back to a procedure-heavy job, such as doing neonates, for example. And with that comes in all of these other things, so anxiety about decision-making, people who've been in research wondering how they're going to write up their PhD while also doing a clinical job, so that goes back to this sort of balancing all these competing priorities. And then worries about working part-time. So many people are coming back to a different work schedule, and they're worried about how they'll be perceived if they do that, how they'll be able to function, complete their training, and whether that will hinder their full immersion on return. And in regard to new parents, often they are worried about being more emotional in paediatrics now that they have their own children. So having to treat unwell children who may be the same age, or remind them of their own children, how do they cope with that when they're trying to look after those children? So these are all really important things that have come through, and we know that these are common themes about the challenges that trainees face. So what can we do about this? So over time, we sort of really thought hard about how we could think about some top tips. And one really is to plan ahead. And if you can, I think there are some breaks from training which can be unplanned. Clearly, if you are unwell or if it's unclear when you're going to return to training. But there are others which have a definite time span, for example, maternity leave being the most obvious. So it's really important that you try and think about the effect the break might have prior to leaving, which can be really difficult when you're getting sort of excited about thinking about your maternity leave or about your research. It seems really far away to then think about what am I going to do when I come back. But I think if you can take some steps to keep in contact with those key people, with a mentor, with your educational supervisor, or at least have had this conversation, then it'll make you feel a little bit more confident when you think in those months and weeks when you're planning to go back to work. Because often I think what happens is that people take the break, it comes to a few months before they start, and they get really nervous and anxious. So part of that is really thinking, what is your stage of training? What is it that you're trying to complete alongside your day-to-day clinical work? Is it that you need to do your exams? Is it that you're towards the end of your training and you need to think about START, for example? Or is it they're in your middle in that you're going to be transitioning between SHO and registrar? So really thinking about how that break might affect what happens when you come back. And then thinking, how will you keep in contact with the workplace? I mean, it's much easier if you're going back to the same trust, but we know that the large majority of trainees actually end up at a different trust to the one that they left. So that can be really tricky. But it is useful to think about, is there an educational supervisor or clinical supervisor, mentor, someone who's been in the same boat, for example, somebody that you work with who's also been on maternity leave or is now working less than full time, who could be a source of support and advice. Think about what job you'll be returning to. So again, is it that you're going to have a break for 3 years and then the plan will be that you'll come back to a neonatal job, for example, and you feel that that maybe isn't your area of strength? Or again, that you'll be returning to a different level with different responsibilities? And will your job plan be different when returning? For example, do you plan to return less than full time? And so what will that job plan look like? Are you going to be doing 60%, 80%? Have you spoken to your TPD about that? So the way to do all of this is that we have adapted a checklist from the Academy of Royal Medical Colleges about a planned absence checklist. And we think it's really worth going through this on your own, but also with your educational supervisor before you leave. So what about when you're about to return to work? What would be some useful things to do then? So we think it's really important to reflect and then act according to what those reflections are. So it's important to really reflect on what you're most worried about. What are you nervous about? What gives you anxiety? Is it, having to lead a team? Is it that you're going to an A&E job and you're worried that you're going to have to be working a lot in resus? Is it that you're concerned about your clinical skills and you're not sure about intubation, for example? Is it that you feel that you haven't done APLS for a long time or you're not aware of the latest guidelines? So it's really important to sort of think about those things and then really think about the other sort of softer things. So are you worried about how childcare is going to be an issue, whether you're going to be able to finish work on time in order to do the nursery pickup, and how all of those things are going to come into place. So it's really useful, I think, to go through that and make a sort of list of issues, because then you can be really practical and think about what measures you can put in place prior to returning to try and counter some of those things. So what measures can you practically put in place? Well, one obvious thing I'll talk about is KIT days. That's keeping in touch days. And you can use those not just for clinical work. I think people feel that they have to do that in the trust that is paying their maternity leave, and that it has to be there. But actually you can use educational days. You can use courses such as APLS and NLS. You can use a return to work course, for example, a transition course, or sim training. So think outside of the box about the KIT days and how you could use those. And it could be that you do them back in your trust and you do clinics or clinical work, and you may even be able to organise with the trust that you're returning to, even if they're not paying your maternity pay, that you could do some work there and then get paid by your trust that you left. And I'll talk a little bit about that when we talk about keeping in touch days. Other things to think about is whether you do need occupational health input if you've been away because of ill health. So it's important to make those make sure that you have those appointments early on. E-learning are things that you can do at home or in your own time. Clearly, talking to your educational supervisor in TPD is really important, and particularly if you're going to go back to less than full-time training, for example, or you're worried about transition and you think that you might need more support, or maybe a period where you have more supervision. And again, there's another checklist, the return to work checklist, again adapted from the Academy of Royal Medical Colleges, and this is a really useful again, way of just going through and making sure that you've ticked all of those boxes and you've addressed all the anxieties that you might have. And I think I can't stress this enough. Really, don't be scared of asking for help. There are so many people who've been in this boat. I think we're all aware that paediatrics is generally a really supportive specialty, and it is female dominant. So there are lots of people who've been on maternity leave, worked less than full time, done PhDs, have had to write up PhDs when they've gone back to clinical work. All of those challenges somebody else will have been through. And if you ask, then you'll definitely be able to find someone who can help you out for it. I think the assumption that lots of people make is that people will know that you've had a break, but we know from the educational supervisor we've spoken to in the trust, often they get very little information about the trainees who are coming to them. So don't assume that people know that you, for instance, had 5 years out and you're feeling really quite rusty and you need to have some support. Ask for that help early. Get in contact with the trust, get in contact with the educational supervisor, and make sure they know what your concerns are. As I said, it's really useful if you can find a friend, someone who's been through it, someone that you trust and can act as a mentor, even someone who can just talk to you about how you fill out all the paperwork for doing less than full time, or how you job share. There are some really useful tips that you can glean just by talking to others. Think about whether you need extra supervision or whether it would be useful for you to be supernumerary for a time. But in order for that to be organised, you really need to be talking to people before you get back to work. And the other thing is that there is lots of resources out there for professional coaching for trainees who are in London. There is a professional support unit at the deanery, and they provide both coaching, mentoring, and careers advice. And many other deaneries will have similar schemes, so you can access this, and don't be afraid to do so. And remember, Trish will talk a little bit about this later, but it takes time to transition back to work. So try and be kind to yourself and don't give yourself a hard time. It's going to be difficult to perform exactly as you were before you took time out, but you will get there. So these are the checklists we've got. At the end, we'll show you the link on the London School of Paediatrics website, but we've basically adapted these so that they make sense for paediatric trainees. And you can see there the questions about talking about how the length of absence, what are the responsibilities you'll have in the post, so then you can flag up whether you're going to be having a step up to more responsibilities, talking about how you feel about your confidence and skill levels, what support you'd find to be useful, what work you've done to keep in contact during your absence, if there have been any important changes. Maybe there's some new guidelines. You're going back to an A&E job and they've changed how, for instance, how they manage sepsis. They've got a new sepsis 6 guideline in place. It's important to sort of know those things and talk those through so you feel that you're up to speed. thinking about your GMC license, if there's anything that that needs to be tackled with about your competency requirements for level of training and revalidation. If there are any new issues that have come up and things like stage return. So you can just see that not all of these may be relevant, but it's really useful to go through that with your supervisor, maybe fill it out before you go to work or meet with your supervisor before you return to work, and then certainly have a chat about it once you are back in work. So keeping in touch days. What are they and how do you access them? So these are paid days as part of your maternity allowance or adoption leave, and they are also called, now with the parental leave, there is also an allocation there, they're called split days. You can have up to 10 kit days during maternity leave and up to 20 split days during parental in-touch days. And the aim of these is to prepare for the transition back to work. As I said, that work can include not just clinical work, but also lots of other educational activities. Even part of a day or a few hours will still count as a whole kit day. They do not have to be consecutive, but what doesn't count is just a meeting to discuss, for example, your return to work, or for instance, just taking your baby in to meet your colleagues. It is about trying to do some work that will prepare for your transition back. It can be taken at any point during the leave apart from the first 2 weeks after your baby is born. It doesn't extend your maternity or paternal leave, and it cannot be taken during your annual leave. So just be aware of this if you're taking a block of annual leave at the end of your maternity leave before you return to work. And they are paid days, so they'll be your basic pay. But if you are receiving maternity pay during that time, you will subtract maternity pay from that. I think what we know is probably only about 10 to 20% of trainees actually will access these keeping in touch days, and we really want to make sure that people are aware of these and that they talk to their trust and their HR departments, and also that they talk about what is eligible, because that is due down to the discretion of the trust. But certainly from my perspective, I've used a educational day. I've used going in to talk about an audit project with my educational supervisor. So there are loads of things that you can use as keeping in touch days. It's a bit more tricky if you want to do those days of clinical work at your a new trust, but it's worth exploring this and seeing if you can make that work, and you can get your old trust to agree to pay for work that you might do in your new trust. Okay, so thank you so much. I'm going to hand over now to Tricia to talk about the Paediatric Return to Acute Clinical Practice course.
Great. Thank you, Sarita. That was a great summary of tips that trainees can use for their transition back to clinical practice. So my experience is I've actually been supporting trainees in this position for almost 6 years. There was a pilot course run through the School of Paediatrics in around 2012, and I started joining that in 2013 for people returning back from maternity leave. And it was very different to the course we run now, but the concept was the same. And the concept really is creating a safe environment that these trainees can be exposed to clinical scenarios, discuss their concerns, and be updated on changes in clinical practice and changes in education. The course as it stands itself is funded through the London School of Paediatrics, and that's been supported since 2014. We're fortunate enough initially to be supported by the Simulation Network through funding through them. And the way it's developed over the last 6 years is through feedback from the trainees who have attended. And we're very grateful because a lot of those trainees actually carry on to become faculty. And what's happened is through time, it's become a course that was very informal and very that carried out low fidelity simulation, and it now includes high fidelity simulation and quite formal sessions on support resilience. And we've tapped into lots of other resources through our local School of Paediatrics and Deanery, and also resources that are available nationally. What we've done is now we are able to run the course 4 times a year. And that's because of the demand, really, and that is, as Sarita said, because there's trainees taking time out for lots of different reasons. So obviously maternity leave still carries a big part of reasons for time out, but we support trainees coming back back from times out for educational purposes, leadership roles, research roles, career breaks, and it's fascinating to hear their reasoning. And it's really important that the course is bespoke to all those individuals. We try to run it at times of transition, so we know that typically paediatric trainees change over their rotations in March and September, and what we find is the highest demand is for courses around that year, those times. So we run 2 in the spring around January and February, and then 2 in the summer around July and August. And at the moment that seems to be meeting the demand. We on average have 20 trainees who attend the course, and it's quite a wide range of reasons why they've had time out. And we do need a fair amount of faculty to support the course. We support that with consultants who have had time out, consultant intensivists, people who are doing research, people with educational interests. So we really have a wide group of people who support the course, and that's what makes it successful. So I wanted to show you what we cover to really show you what the demand is, and this is how it's what it's involved into today. So our next course is in July, and this is what it will look like. It's a really intensive course, actually intensive for those attending, because sometimes it's their first time back into the work environment, so to speak, meeting old colleagues, meeting new colleagues, going back into a clinical scenario, even if it is in a simulated clinical scenario. So it can be quite daunting, and the day is quite intense, as you see. But our main aim through the whole day, as I said in the beginning, was to create a safe environment, and we really work very hard to ensure that throughout the day. And the aim is to keep it as a confidential, safe environment where these trainees feel that they can ask the questions they wish to ask, they can run through scenarios without being worried about being judged. So typically we have a little introduction and icebreakers in the morning. We then split the group in half. This is often done prior to them joining, depending on their needs. And the first half of the group do 2 basic scenarios. Now we're very clear that the scenarios we pick are really irrelevant to this course. The point is to be able to transition these trainees back into the clinical situation. So to be whether they're the registrar, to be the registrar leading a resuscitation, or the SHO going back into assessing an acutely unwell child. What we do is pick our scenarios from a bank of scenarios that the London School of Paediatric Simulation Network have created, and they're transparent, they're available for everyone to see. They are used multiple times through training, so it's not anything we would expect the trainees to not have been exposed to. The way we plan the course is we often choose scenarios such as bronchiolitis, so something common that we expect trainees to be exposed to in their clinical work, a neonatal scenario, and then we have 2 scenarios that we would pick something slightly more complex, but again the case isn't kept as complex, or it isn't designed to trick anyone. So we run the first 2 scenarios, and the other group has what we call hot topics. And it's interesting because you speak to these trainees and they're hungry for information, and this is their lecture. They get a 1-hour lecture delivered by one of our faculty on what's changed in paediatrics in the last year. So to give you an example of what we've included over the last 2 years, we've talked about the new DKA guidelines, we talk about the new BTS guidelines for asthma, we talk about obesity, we will talk about political cases that are occurring, just so everyone feels in the know. And the point isn't to educate them so they remember every single fact that we have shared with them. The point is really to signpost them to what's happening. So if we've signposted to the Paediatric Sepsis 6, the slides are always available for the trainees, but it would give them the opportunity to go read about it, or it may just trigger as a little reminder if they're in a clinical scenario when they do return and a child is thought to have sepsis. That's very popular, I suspect, because as learners we're all very used to learning in lecture form, but the emphasis isn't on that session. What's interesting is over the last few years we have built in a session on, we call it an e-portfolio session, but actually it is about education. So It covers the portfolio and the changes that have been made to the portfolio. You can imagine if you've been out of training for a few years and suddenly you're exposed to a new e-portfolio, you're not sure how to access your resources, how to complete your work-based placed assessments. We signpost to that to really take that anxiety away, and hopefully it allows the trainees to then go back and have a little play with their own account and see what's there. Currently, we're building in the new RCPCH curriculum because, as you know, the curriculum's being updated and rolled out, and so we will be signposting to that as well. And so that session is really for the trainee to focus on their education and really remind them that, yes, they're going back to the clinical environment, but their education and their personal development is just as important. And there's a little coffee break in between, which we encourage these trainees to network, and what we see, which is beautiful, is just peer mentoring throughout them, whether it's the faculty mentoring or trainees who have been on breaks previously and are on the course for a second time mentoring others, and a real supportive network that happens in the lunch and tea breaks. And then, as you can see, the groups swap over and they do the sessions they haven't done. We then have a funded lunch, which I think is really important. The last thing we want is people coming to the course and then worrying about and considering where they have to get lunch. And we think that the lunch break is, again, an important time for them to network. And so we want to take away the worry about them having to where they get lunch, and actually seeing the group split up, we try and keep them together as much as possible. What we've noticed is that there's a huge demand for more simulation. And so in the feedback, we found lots of people want support and training on part tasks, such as neonatal intubation. So we keep a little session going, which is voluntary in the lunch break, on just intubating a newborn. And that's not taught, it's more supported. And then the afternoon is a bit more based on self-care. So again, one group will do the two other scenarios we discussed earlier, which at times we may do things like myocarditis or the acute abdomen, and we'll debrief them in the group. And then the other group will have a supported session on less than full-time training. And that session is optional. So those that don't wish to do that session may do the simulation. And there's real flexibility in the course. Often that session is supported by someone from our School of Paediatrics who actually does the matching for the less than full-time training. And that's brilliant because they can actually put a name to all the emails they're getting and answer really direct questions. And we really enjoy seeing people troubleshooting and actually walking away finding that they've solved a problem. What's been the little surprise about this course, and we really enjoy, is a session we've continued to run on self-care and resilience. It started as a session on work-life balance when it used to be the return to work for maternity leave course, and that was really talking about how do you manage your childcare and getting your sign-offs done and things that are related to people who had kids at home and were working part-time. And as the candidate groups have increased, and as I think the faculty have grown, and as time has gone on, we've seen there's been a real need for support with regard to resilience and self-care. And we will talk about that in a little bit. What's interesting is that certainly Sarita and I wonder whether this session is useful because we often run this ourselves. Occasionally we're supported by the professional support unit and a formal counsellor, but actually the feedback is always phenomenal, and there's a real drive and need for support with regard to resilience and self-care. And to date, I think we've been the only course that really provide both this holistic aspect as well as the clinical aspect. And then, as you can see, the group swap over after that. What I'd like to talk to you about is the debriefs that we carry out. So I told you that which scenarios you pick really aren't important. It's interesting because as the educator on this course, I have no preference of scenario because actually my priorities are almost the human factors. So ensuring these trainees get back into the clinical environment, ensuring they understand how to escalate and where to escalate and when, but also where they can get their resources and having the confidence to say, I need help. And that's the things that I like to debrief. What I often find is the trainees want focus more on the educational aspects, But what I love about our course is that we address both bits. So really focus on these human factors that are so very important, as well as the educational bits. And we'll talk about that a bit more. So to give you an idea of attendance that we've had, we have a huge range of trainees attend. We have had a few nurses attend the course, and we would love to extend the course to more nurses, and are trying to work on that. But you can see that people have time out for different reasons, so whether it's maternity leave or research or other breaks, as we discussed, and the course is available to everyone. The one thing we do say to everyone who attends is that there is a confidentiality agreement. It's verbal. We never ask anyone to put anything in writing, but we do say when you attend, it's a safe environment. Whatever happens in these rooms stays in these rooms, and that's partly because you might actually be in the course with your consultant who's had time out for sickness, for instance. So it's really important to respect those boundaries and understand that everyone's feeling anxious and everyone is going through the same transition, whether it's whatever level of training you are. We've talked about the reasons for absence, and you can see the majority are maternity leave, but we're also getting a wide range of other reasons. And as Sarita said, that it's known that there is a risk of loss of skills, and so it's really important for anyone who's had time out to think about their plan on coming back, so whether it's going on a course like this or some of the other things that we've signposted to. And I think that's becoming more recognised, which is why we're seeing more candidates with reasons other than maternity leave come on the course. So we wanted to share our feedback, because the feedback is phenomenal, and really to motivate you to attend a course like this in your deanery, to seek out a course. Obviously come and join our course, or if you're thinking of setting up such a program, to see where the need is. And you can see generally every single aspect of the course has been well received. The simulation's always well received. The lectures, there's such a hunger for. The educational aspects we're really keen to continue, because it's really important to think about yourselves and think about education a little on your return, because you can almost get a little distracted with the clinical needs that are there. And the work-life balance, the resilience and the self-care aspect is really important. We didn't talk about in the previous slide that we do run a session specifically for those coming back from research, from time away from completing research, and if they're looking to maintain their research skills. So we keep that as very bespoke for a handful of people who actually ask for those sessions. And we have someone come, a guest speaker often, who's either returned successfully or who is a research clinician, and that's also really well received. This was a little bit what this slide talks a little bit about what we discussed with regard to the debrief, and what we found from candidates and you as trainees coming back to clinical practice is we understand you've got a hunger for knowledge and knowing the most recent guidelines. And I think, as Sarita said, by all means have a read of them. We signpost to them when we run our hot topics lecture, but no one's expected to know them inside out. I think as long as you know where to get them and where to find them and that they exist, then that's absolutely fine. But we find that even with the clinical debriefs, often the conversations drive towards, oh, what is the management of bronchiolitis. What we've moved to doing in our debriefs is keeping a micro teach. So if we're running a sepsis scenario, in the middle of the debrief, we will do a little micro teach on what is the sepsis 6. The other thing that we find that you as candidates are looking for is almost opinions from us and inference from us, so really what our thoughts are and your performance. And obviously that can provide a degree of reassurance, and we ensure that every debrief is done safely, securely and in a positive manner. But the thing to remember is you don't need that feedback from us. You need to take yourself to a point where you feel comfortable on your return. And that some of that is doing the things that Sarita has signposted to. what we try and do is, when we're feeding back, is remove our opinions. So yes, we may have our own special interests when we have intensivists who come and support the course, or we have specialists come, and that's great and fantastic, and we really enjoy that. But our opinions and our thoughts on how you perform are irrelevant, because actually we want you to focus on what your feeling was and your thoughts were, and how we can get to you to a point where you feel confident in going back. And that's what our aim is for the day. So we start probably at around 8 a.m. and we finish at 5 a.m. and we hope through the day you leave feeling confident, and that's what we try to build. So whether it's in the debriefs, whether it's in the resilience sessions. And with regard to the debriefs, we just gently try and push you towards thinking about your thought process and taking you to the next level, and applying knowledge that you think that you may have forgotten, and which is actually there, or if you don't know it, how you find it. And we hope that that helps that first resource you have on your return. So I wanted to share with you some of the feedback that we have had over the last few years. It's a priority for us that we maintain our course and develop it according to the feedback. And you can see in some of the quotes that we've had from our feedback questionnaires that we have changed the course with that. So you can see there's a focus on resilience. The debriefs are kept supportive. We try and keep the scenarios realistic but challenging. We talk about being kind to yourselves. There's been suggestions about rolling it out further. And making sure that these trainees feel safe, so not kept out of depth. And that's really important. And almost ignite that passion that we've all had when we joined paediatrics, which may have, whether it's almost been forgotten or diminished on that period of time out. And that's what we aim to do. And the one at the top that says relaxed, non-threatening environment is also really important. So I told you that we do focus on resilience and self-care, and some of that has come with, as the faculty has developed and as the feedback has been suggested that there's a need for it, what we've recognised that whether it's a consultant or an ST1 coming on our course, or an ST3 going into an ST4 post, actually all these trainees are going through a transition, and actually there needs to be an element of thinking about their resilience and how they're going to look after themselves. It's funny because when you think about resilience, you know, you think about what it means, and it comes from the word resilio, which means to bounce back. So to see what capacity you have to extend and stretch without snapping and bounce back to the position you were or in a better position. And that capacity will be different for different people, and that's really important to know. But the priority is to really figure out what your capacity is, so you know which bits you can cope with and which bits you think is going to make you snap and not to get to that point. Some of the thoughts we focus on about resilience is being kind to yourself. So there's a technique called looking at yourself with kind eyes. And it's funny because as clinicians, we are all very compassionate and wonderful to our patients, where we hear our patients are going through something, whether it's physical or emotional, and we understand how to be kind to them and support them and what words to say. Just like with our peers and our colleagues, if we see they're going through a difficult time, we are fantastic at supporting them and very compassionate. But what I've noticed is that we're not so great at being kind to ourselves. We almost have an inner voice that is a little mean to ourselves and critical and not kind. And one of the things we ask our trainees on the course to do is to look at yourself with kind eyes, or what would you tell your colleague if they were going through the same things you were going through, and find a way to tell yourself that. And that's called reframing your thinking. So if your thinking is becoming quite negative, to actually reframe it, to ask yourself, what would you say? What is the alternative? What is the worst case scenario? And how bad does that look? And is it as bad as you thought? And there are techniques you can use to do that. And we do focus on that on the course. What we also do, and what we recommend for anyone who's coming back from a period of time out, is to focus on their strengths. And this is what Sarita was talking about, to reflect, take some time out and draw out what your strengths are, what you think your strengths are. Actually look through your MSFs and see what your colleagues have said about yourselves, because those strengths will come back. There needs to be a degree of self-belief to be able to focus on that transition. The other thing that we discuss is building a network, and what's great through the course is you can do that during the day, but there are also Facebook pages out there, or Twitter groups, or you can reach out to the deanery and say, is there anyone else who's going to be my job share that I can reach out to? And it's really important to have those networks to support you. No one's actually saying that you can do any of this alone. Sarita and I probably didn't get a chance to say, but we've both had periods of time out for different reasons. And so we really use our own experiences to really ensure that the feedback we give is something that's helped us, as well as the experiences of the trainees who've come through the course. And then the last thing is, I think we all know that change is difficult to accept and transition is a challenge, but actually accepting change. And some of that can be done through some of the things we've signposted to, but also other things that we suggest on the course, which is mindfulness, which we'll be talking about shortly. So one of the last few slides we have is the resources you can use for resilience and self-care. So it's really important when you're going through this transition, when it can be busy, you may want to throw yourself into work, to keep a short period of time for those skills that you do or things you do that keep you relaxed, whether it is socializing with your family and friends, exercise, music, listening to music, playing music, any of the creative arts, going to the movies. Often we can forget that's really important. So it's really important to plan a short period of time in your transition and make sure it's built into your timetable. If you feel that you need more support, or you think that there needs to be more, you need more help with regard to building your resilience and self-care, there's lots of other things that certainly we signpost to and we've practiced ourselves that can be accessed. So the London School of Paediatrics has a peer mentoring program, and I know lots of schools throughout the country do as well. And that's fantastic, because you've actually got paediatricians and peers of your own that can support you, and often they've been through something that you're going through. There is formal counselling and coaching available, as Sarita said, and it's worth going onto your deanery website and accessing your professional support unit. And that can be careers coaching or personal counselling as well. What Sarita and I signpost to is guided meditation, and certainly we signpost to free and paid apps that are available, and we do provide our trainees with some as well. And that is certainly to practice mindfulness, and we found that that's helped us personally, and lots of trainees that we've spoken to, it does help. So we recommend that. So what does the future look like? As Sarita said in the beginning, there's a real understanding that this group of trainees need to be supported, and we certainly champion that as well. And there's a drive from Health Education England to provide consistent support for these trainees and really have a culture of change in the workplace, so that every individual involved in someone's return understands what needs to be done and why support is important. There's a recent document available called Supported Return to Training that signposts to national programs that are available, and the link will be available for you to download it, and certainly you can look at your own region and what's available there. And also just speak to your TPDs or your educational supervisors if you're unsure. these are the resources that we've used to create our program, and also some of the work that we've signposted today. Our contact details are on the London School of Paediatrics webpage, so if you feel that you'd like to get in contact, please do. There's lots of other brilliant information available on the BMA website and the RCPCH website too. So we're really grateful that you were able to come and listen to this today, and we hope that you found it useful. I think Sarah's going to open us up to some questions from you now that we'll be happy to answer.
Great, thank you to Sarita and Tricia for such a useful and really timely and important topic. We do now have 10 minutes for questions. Those of you who've logged in through GoToWebinar will find a questions box on your screen. So please do submit your questions to us now so we've got the time to respond to them. While you're thinking about your question and submitting it, we do have some questions that were sent through earlier. The first one is, how do I claim Keep in Touch days if I'm returning to a different trust to the one who was paying my maternity pay?
Okay, so this is a really this is a question that does come up a lot, because as I said, often KIT days were designed to be taken in the place of work who is paying a maternity leave. We know that there's lots of trainees who are going to a different trust. At the moment, my understanding is this is quite individual, and it really takes a bit of talking to the people involved. So whether that be talking to your new trust and finding out what is it useful that you could do. So would it be useful to do a clinic? I mean, some of this is really dependent on what job you're returning to, so, and what it is that you want to get out of it, and what kind of experience you'd like before you go back into the workplace. But if, for instance, it's doing a bit of work on the A&E shop floor or doing some clinics, then you will need to speak to your new trust, because it may be that you need to have an honorary contract for that before you start back at work. That can be organised. I know people have managed to do that. The other way is that you can organise it as a sort of educational activity and sort of get it signed off as study leave, even though it's in another trust. So if it involves sort of going in and, for instance, doing a clinic or sitting in on a clinic, then you could maybe have that as an educational activity and then get your old trust to sign it off. But what's important is that whatever you arrange, just make sure that you talk to the HR department at the trust that's paying for your KIT day to make sure that they agree that this would be an educational activity that they will pay for, because it'd be a real shame for you to do the KIT day and then not have it recognised or paid for. But I think really at this moment in time, without any clearer guidance, it's about really talking to your new trust and seeing what can be organised. But I would say that in the meantime, there's loads of really important things that you can do in terms of going on courses, going on the kind of the deanery educational days, half days, all of those things, just to get out, put some work clothes on, have some time away from your baby. For example, if you're coming back from maternity leave, can be really important ways of just making your brain get back into work mode.
Thank you. The next question that we've had is, I'm worried that people will see me differently as a less than full-time trainee and I will miss out on opportunities. So how can I tackle this?
So I have to say that I was a less than full-time trainee, and I really didn't feel that at all. I think it's all about how your presence is when you're clinically, when you're in the workplace. You can be working 3 days a week and be 100% present and still be just as effective and just as dynamic and just as recognised as your colleagues who work 100%. I think that concept, I understand that historically that probably has been seen, but what I've seen with the way paediatric training has been in London, where lots of trainees are going less than full-time for various reasons, actually there's more recognition that that's acceptable. And also I think how you present yourself is more important. So certainly I worked 60% from halfway through my ST6 until I was a consultant. And I felt that when I was at work, I did actually bounce into work because I'd had my couple of days at home with my children and felt excited to go into work, and I was like a breath of fresh air, which is what some of my consultant colleagues said, that I would come in on a Wednesday and I'd be energized, and it was the beginning of the work week for me, and when I was present, I was fully present. Some of the things that Sarita signposted to you two would be super helpful. So if you are worried about being less than full-time, ensuring that your childcare and your setup and your situation is such that you're less worried about what's going on about at home will allow you to be more focused at work and more be able to be more present. And so certainly for me, my children were little when I was a trainee and they were at nursery, but I didn't have to worry so much about the nursery because the hours that they provided for us. And so I actually was able to focus on work. So my conclusions would be that attitudes have changed, which is good, but also the way you present yourself will prevent any concerns that you would have.
Can I just add as well, you've got much more time, so just remember that you don't have to fit in everything that you would do in your full-time job, because it is less than full-time, so you will have almost double that time to achieve all those things. And one of the really great things is that often you are in the trust of the job for much longer than you might have been, so 12 months rather than 6 months, for example.
Following the end of this webinar, further questions were submitted. The first was, is it an option to have a graded return to work after maternity leave, and over what time? And the speakers advised that yes, it can be negotiated in your trust, but there are no clear timelines that have been identified, so it is up to you to negotiate. A further question was, can consultant paediatricians have return to work meetings after they have been on maternity leave? And the speakers advised that yes, the Academy of Medical Royal College's return to work guidelines do apply to all healthcare professionals, not just those doctors in training.